Second, I think is important because it's an opportunity for all of you to hear from the brand owners, and we have today both the R&D side as well as the procurement side very well represented. So that's one, and the second piece is I have the responsibility of asking some tough questions to these guys on your behalf. So it's basically to ensure that the time is well invested for not only you but for all of us. Yeah. With this, I'll
sustainability goes. Most of the consumers would like to do something for the Mother Earth. They would like to do something which is having a positive impact, does not harm the environment in any way. And I'm also, and this applies across the levels, across types of consumers, across geographies. And I speak from this experience, where for Pidilite, the consumers are sometimes artisans, sometimes, carpenters, contractors, and all of them. And when we have gone and engaged them, when we have gone to spoken to them about sustainability, about, using of recycled content or recyclable packaging, they've all, embraced with open arms. So while I say this, it is also that there is a responsibility here with the brand owners, and that responsibility is to make this entire packaging or sustainability journey relevant to them. And that's the challenge, how do we make the relevance? So and this understanding of consumers, as far as sustainability.
So if I see the journey of packaging sustainability in last 5-6 years, the brand owners were really focusing on the recyclable structures. So that's where right point is category 2. Is it really classified well, or is it need to be elaborated in more details? Because technically it looks like everything is recyclable, multi-layer plastic, right? But if I compare PET poly versus a polyolefin family like BOPP, CPP, and the monomaterial like MDOP and P structures, all has the different value chain and different recyclability. So we need to look at a different lens. So I clearly see a gap in terms of classification, right? Brand owners put a lot of efforts into engineering the recyclable structures, doing the changes in the machine. And then finally we'll end up, we don't have any solution for the PCR.
Journey of sustainability, and as in FMCG companies, we really look what is the end result of that material. We don't have to narrow down into a one stream. For example, we are not talking about just reducing the plastic, because reduction to plastic can happen. Yes, it's a good way to reduce the plastic or addition of a PCR, but it can happen to a certain limit. And for a consumer, he's ready to pay for it. He's ready to compromise for it, but to an extent. But the intent of a packaging which is meant to protect the product, and if that intent is lost and that consumer delight is lost, then we are losing a consumer. Hence, we need to be very careful when we are choosing, and that's something which is there. And we interact with a lot of people. If I say from a flexible, from additives, so additive companies are doing a lot of work on on additives, flexibles, alternate material.
And particularly, there are three challenges which, as a procurement professional, I face every day. One is the traceability challenge. Today, regulatory talks about traceability, which is good. We push for digitalization of the entire value chain. How the rack pickers are picking up the material, and how much they are collecting, how much we are buying as a certificate. But end of the day, if you talk about the industry value chain, we rely 80% on the rack pickers, kabadiwalas. Lot of transaction happen in cash. Even trust is the factor where they just put the waste and they get the money. So the question to the industry is, are we pushing the industry to more like black market or a alternate, like only the paper industry where they are generating procurement?
Thanks, Hitesh, for giving at least the last introduction, which is a sense of how consumer healthcare is into, sandwich between healthcare and FMCG, which is typically a challenge because in our product, it's typically put into shelf and consumer has a choice. For in terms of pure pharmaceutical product, doctor prescribed, you need to buy. So we are playing into that kind of situation. But being a packaging technologist and when this EPR and all has started, we have also started evolving. And I will just give you just two small example how I'm sure that can be a insight for how improvised as Indian we are. I mean, for example, we have a brand called Nicotex, which is typically for helping quitting smoke. That used to have a blister format, which is a PVC as a plastic and aluminum foil. That means it's having a PVC, which is a very apprehensive polymer, everybody knows.